Hello everyone. Today we will shortly discuss how to interpret urine analysis report, especially when there is suspected urinary tract infection. See, first what we have to do is, in the report, look for presence of pus cells. If the pus cells are more than 5 to 10, that will indicate few things like either infection or inflammation. So these WBCs will indicate either infection or inflammation. So we have to know few of the reasons for this increased pus cells or WBCs. For example, when it comes to infection, mainly urinary tract infection, whereas regarding inflammation, it might be due to irritation by kidney stones or interstitial cystitis. So these possibilities we have to keep. Not like seeing pus cells will always indicate urinary tract infection. So this is the first thing we have to know. Then next we have to focus upon the bacteria. You might have seen the results like nil, 1 plus, 2 plus, etc. So presence of bacteria, if detected, there might be several possibilities. For example, there might be actual urinary tract infection by the bacteria which will be appearing in the sample. So here what will be the associated finding? There will be increase in the WBCs as we have seen previously, and there should be clinical symptoms as well to consider urinary tract infection. Otherwise, in some individuals, there will be asymptomatic bacteriuria. That is, patient will not have any symptoms suggestive of urinary tract infection, but when we get the urine routine done, there will be presence of bacteria. So this is one more possibility. Otherwise, these bacteria might be due to contaminated sample. So from the skin or vaginal flora, there might be contamination. So all these three possibilities will be there when we see presence of bacteria in the urine. So we have to look for the associated features always. For example, if it is contaminated sample, bacteria might be there, but there will not be any increase in the WBCs. Whereas in asymptomatic bacteriuria, there might be presence of bacteria, but there will be very few or no WBCs. Along with this, there will not be any symptoms. Whereas in urinary tract infection, bacteria will be there. To fight that, there will be increase in WBCs. Along with that, symptoms will be there. So all these things should be there to call it as urinary tract infection. Then we have to look for presence of epithelial cells. Remember, up to 5 epithelial cells is considered as normal. So suppose there is increase in epithelial cells by more than 5. Again, we have to keep few of the possibilities. First of all, epithelial cells might be because of the contamination from skin. We all know that skin's epithelial cells might be contaminated because of the poor sample collection technique. So this might be one of the possibilities. Now sometimes because of this contamination, we will get increased epithelial cells as well as there might be bacteria from the skin or vaginal flora. So in that case, just remember there will be no increase in the WBCs and the presence of epithelial cell count will be higher, which will indicate the contamination of the sample. Whereas if there is actual urinary tract infection, we usually will not see increase in epithelial cells. Instead, as I mentioned, there will be presence of bacteria and there will be increase in pus cells along with the symptoms. So these false increase in the epithelial cells will not be there when there is actual urinary tract infection along with a proper collection of the urinary sample. If there is improper technique, then there will be falsely high epithelial cells. There might be presence of bacteria, but usually there will not be any associated increase in the WBCs. This is how we have to differentiate. Remember, we will look for first pus cells. So if they are increased, we have to think of several reasons like infection or inflammation. Then look for the presence of bacteria. If it is present, it might be due to UTI or asymptomatic bacteriuria or improper collection. Then we will always assess epithelial cells. Normally, in a properly collected sample, there should not be any epithelial cells, or till 5 epithelial cells is considered as normal. Suppose there is increase in the number of epithelial cells, we have to think of contamination from skin or vaginal flora. This is how we should interpret urine analysis report. Hope it will be useful in your OPD practice, and with this we can avoid unnecessary usage of antibiotics, which we will be end up in giving if we don't know how to analyze the urine report. Thank you so much.